To understand the profound physiological and neurological transformation that occurs when you massage your ears with extra virgin olive oil every night before sleep, one must abandon the simplistic notion that the ear is merely an external cartilaginous appendage designed solely for the acoustic collection of sound waves. In the realm of clinical neuroanatomy, the human auricle is recognized as an extraordinarily complex, highly innervated neuroreflexive control panel. It is one of the only external locations where the vagus nerve, the foundational superhighway of the parasympathetic nervous system, reaches the skin's surface. This specific cranial pathway is known as the auricular branch of the vagus nerve, or Arnold's nerve. As the human body crosses 60 years, the autonomic nervous system frequently becomes dysregulated, locking the individual into a chronic, low-grade state of sympathetic overdrive. This elevated sympathetic tone is characterized by a constant, invisible drip of cortisol and adrenaline into the bloodstream. This is precisely what causes the fragmented sleep, nocturnal anxiety, and elevated nighttime blood pressure that plague so many aging adults. When you apply deliberate, rhythmic tactile stimulation to the external ear, you are effectively sending a massive electrical signal directly up Arnold's nerve. The signal goes through the jugular foramen and straight into the medulla oblongata at the base of the brainstem. This signal instructs the brain to immediately forcefully downregulate the sympathetic nervous system and activate the parasympathetic rest and digest protocol. Heart rate variability improves, respiration deepens, and the body is biochemically authorized to transition into the restorative phases of deep sleep. However, executing this massage without a biological catalyst provides only a fraction of the potential benefit. The introduction of high-quality extra virgin olive oil transforms this mechanical stimulation into a deeply penetrative biochemical intervention. Olive oil is not merely a culinary fat, it is a complex bioactive lipid matrix. When warmed slightly by the friction of your hands and applied to the highly vascularized skin of the ears, the oil significantly reduces surface tension. This allows for a deeper, more sustained myofascial release, without tearing or irritating the thinning, fragile epidermis, typical of older age. But the true medical efficacy lies in transdermal absorption. The skin covering and immediately surrounding the ear is remarkably thin. This allows lipid-soluble compounds to bypass the gastrointestinal tract and penetrate directly into the subcutaneous tissue and localized capillary beds. Extra virgin olive oil is densely packed with a unique phenolic compound known as oleocanthal. In studies, oleocanthal has been proven to exhibit the same biochemical mechanism as ibuprofen, acting as a potent, natural, non-steroidal anti-inflammatory agent. As you massage the oil into the earlobes and cartilage, this oleocanthal is absorbed, actively inhibiting the COX-1 and COX-2 inflammatory enzymes. This localized anti-inflammatory cascade is extraordinarily beneficial for the temporomandibular joint, or TMJ, which sits mere millimeters away from the ear canal. By targeting the source directly through the skin, we achieve therapeutic levels of anti-inflammatory relief where it is needed most. Decades of unmanaged stress, poor dental occlusion, and nighttime bruxism, the unconscious grinding of the teeth, leave the masseter and temporalis muscles in a chronic spasm. This muscular tension radiates directly into the ear and the base of the skull, manifesting as severe tension headaches and unyielding neck stiffness. The penetrating warmth and the anti-inflammatory oleocanthal from the olive oil massage actively dissolve this localized muscular ischemia. The manual manipulation forces stagnant blood out of the rigid fascial planes, allowing fresh, oxygenated arterial blood to rush in. As the smooth muscle fibers finally receive the chemical signals to relax, the mechanical pressure on the trigeminal nerve pathways is lifted. This specific relaxation protocol, performed 15 minutes before bed, effectively short-circuits the neurological loop of nocturnal teeth grinding. You are chemically and mechanically disarming the jaw muscles, ensuring you do not spend 8 hours of sleep unconsciously clenching and destroying dental enamel. Simultaneously, this nightly ritual initiates a profound circulatory rescue mission for the auditory system itself. Age-related hearing loss and the agonizing high-pitched ringing known as tinnitus are frequently exacerbated by compromised microcirculation to the cochlea and the intricate structures of the inner ear. The blood vessels supplying these acoustic mechanisms are among the most microscopic and fragile in the entire human body. When systemic inflammation and age-related vascular stiffness restrict the blood flow through these tiny capillaries, the hair cells within the cochlea begin to literally suffocate and die off, leading to irreversible auditory decline. The sustained, gentle mechanical pressure of the oil massage creates a localized hyperemic response. The friction generates a mild, therapeutic heat that causes the peripheral blood vessels surrounding the ear to physically dilate. This vasodilation acts like a biological pump, aggressively pulling a fresh supply of highly oxygenated blood, carrying essential nutrients and repairing immune cells into the immediate vicinity of the inner ear. While external massage cannot cure structural nerve deafness, the daily optimization of localized blood flow ensures that the surviving acoustic structures are bathed in the precise metabolic substrates they require to function at their absolute peak, frequently resulting in a clinical reduction in the perceived intensity of tinnitus. Furthermore, the anatomical region immediately behind and below the earlobe is a highly concentrated, critical junction for the human lymphatic system. Unlike the cardiovascular system, which relies on the muscular pumping of the heart to circulate blood, the lymphatic system has no central pump. It relies entirely on physical movement and muscular contraction to push lymphatic fluid, a vital fluid containing white blood cells and cellular waste products, through the lymphatic vessels and nodes. In an aging demographic characterized by a more sedentary lifestyle, this lymphatic fluid frequently stagnates. This stagnation leads to chronic low-grade swelling around the jawline, a sensation of heaviness in the head, and a compromised localized immune response, making the individual more susceptible to sinus infections and upper respiratory distress. The downward rhythmic stroking of the oil massage, tracing from the base of the ear down the lateral sides of the neck, actively functions as a manual lymphatic drainage protocol. The olive oil prevents the stretching of the skin while you apply the precise mechanical pressure required to push the stagnant, toxin-rich lymphatic fluid out of the cervical lymph nodes and back into the systemic circulation, where it can be properly filtered by the liver and kidneys. This nightly drainage clears the metabolic debris that has accumulated in the cranial region throughout the day, physically reducing morning facial puffiness and dramatically accelerating the clearance of inflammatory cellular exhaust. When this highly targeted dual-action intervention, the mechanical stimulation of the vagus nerve combined with the transdermal delivery of polyphenols, is maintained over a continuous 30-day cycle, the cumulative physiological shifts are deeply transformative. The most immediate and profound alteration occurs within the architecture of the sleep cycle itself. Because the nightly auricular massage forces the autonomic nervous system to abandon the sympathetic stress response and lock into a deep parasympathetic tone, the brain is finally able to transition seamlessly into the highly restorative phases of slow-wave and rapid eye movement sleep. The chronic elevation of evening cortisol, which previously caused the individual to jolt awake at 3 a.m, is chemically suppressed. Instead, the brain is bathed in a steady, uninterrupted flow of endogenous melatonin. You no longer spend the night in a state of hypervigilant, shallow rest. You descend into the deep, neuroregenerative sleep required to clear amyloid beta plaques from the brain and repair the microscopic tears in the skeletal muscles. Moreover, the dermatological benefits of the extra virgin olive oil become undeniably visible. The skin of the outer ear and the delicate tissue surrounding it are highly susceptible to actinic damage from decades of sun exposure, leading to the formation of deep creases, loss of elasticity, and the development of precancerous lesions. The olive oil acts as a dense, protective, and restorative lipid shield. It is extraordinarily rich in squalene and vitamin E, powerful lipophilic antioxidants that penetrate the stratum corneum and actively repair the damaged lipid bilayer of the skin cells. Squalene acts as an exceptional biological humectant, locking microscopic water molecules into the epidermal tissue and preventing the transepidermal water loss that causes the skin to look paper-thin, dry, and aged. Over the course of a month, the daily infusion of these fat-soluble vitamins restores the structural turgor of the skin, smoothing out the deep vertical wrinkles in front of the tragus and significantly improving the overall dermal resilience. To execute this protocol, the methodology must be exact. One must not use highly refined cooking oils, as chemical extraction processes destroy the fragile polyphenols and antioxidants necessary for the therapeutic effect. Only cold-pressed, high-phenolic extra virgin olive oil possesses the requisite molecular profile. A mere 2 to 3 drops, warmed between the pads of the index fingers and thumbs, is all that is required. The massage must begin at the apex of the ear, gently but firmly unrolling the cartilage of the helix, working methodically downward to the fleshy lobe. The index finger should trace the internal ridges of the concha, while the thumb provides counterpressure from behind the auricle. The focus must then shift to the tragus, applying gentle circular pressure to stimulate the underlying vagal nerve endings. Finally, the fingers must glide down from the base of the earlobe, tracing the jawline to facilitate the lymphatic drainage. This is a slow, deliberate 10-minute tactile therapy session performed while sitting on the edge of the bed or lying in the dark. By engaging in this simple nightly ritual, you are bypassing the need for synthetic sleep aids and costly dermatological creams. You are instead utilizing a profound understanding of human neuroanatomy and the complex biochemistry of an ancient medicinal lipid. You are actively commanding your brain to shut down its stress pathways, manually flushing the toxins from your cranial lymphatic network, chemically disarming the spastic muscles of your jaw, and providing the delicate microvasculature of your inner ear with oxygenated blood. It is a masterful exercise in non-invasive functional biohacking specifically tailored for the aging physiology. It proves that the human body retains an extraordinary capacity to heal, regulate, and restore itself. Apply the precise combination of mechanical pressure and biological chemistry to unlock the deepest, most restorative pathways of the nervous system.